Hello, I'm Dr. Uri. I'm the founder of Lifestyle Champions International, and we try to create awareness around healthy choices so that you can have a good health related quality of life and a longer life for that matter. However, I watched a video a few days ago which showed a preacher. He was actually ministering at the altar, and he was telling the congregation how he almost didn't make it to that event because he had a severe chest pain that kept him awake most of the night. But eventually he made it and was preaching. But you know what? Soon after preaching, he slumped and died. Now, what do you think happened? Was this preventable? Yes, it was. So he had symptoms, but he ignored the symptoms, hoping they would pass. Have you had symptoms of chest pain which you thought would pass but didn't pass? So I want to tell you today what you need to look out for so that you will not fall prey to sudden death or premature death. So what do you need to do? There are certain numbers within your body that you need to be aware of and you need to check out on a regular basis. The first is your blood pressure. There are numbers, right? So your blood pressure is expected to be within the range of 120, 80 and below. But when you have a blood pressure of 130 over 80 and above, but not up to 140 over 90, we call that elevated blood pressure. By the time you're getting to 140 over 90 and above, you're already entering into stage 1 hypertension. And so on and so forth. We have stage 2 and we have hypertensive crisis as well. But we don't even want you to get there. We want to see that your BP is constantly 130, 80 and above. You need to be proactive. And that's why we have Lifestyle Champions International, because studies show that you can actually prevent and control and sometimes reverse all these illnesses such as hypertension just by making simple lifestyle choices consistently. That's one. Number 2, diabetes. You need to check your fasting blood sugar or glucose on a regular basis. It's a number that you must be aware of. People who have diabetes are prone to sudden cardiac death. They're prone to heart attacks, just like people who have uncontrolled blood pressure. So you want to get a home monitor to check your glucose levels. If you're diabetic, please do check at least once a week. If you are not diabetic, check just once a month or once in 6 months, depending on your age. You need to see your physician to give you more information about that. The other number that you need to check is your cholesterol. So cholesterol refers to fat within the bloodstream. So we have the good fat, we have the bad fat. But when the bad fat is more within the bloodstream, what we call LDL, then it can stick to the walls of your arteries and narrow them. And once the walls of your arteries are narrowed, that will reduce the pressure or the flow of blood to important organs within your body, especially the heart. And once that happens, you can have heart pain, which is known as angina. And if it closes up completely, if it occludes a major artery supplying blood to your heart, you can end up with a heart attack in which a part of the heart dies off due to lack of blood flow. And a lot of people don't survive this. Now, these are 3 things I want you to check out within this month. If you haven't checked it out this year, be sure what your blood pressure control is like, be sure what your blood glucose control is like, and be sure what your cholesterol levels are like. So I'll be back again later to talk more about how you can prevent sudden death by checking in with yourself and maintaining healthy choices on a regular basis. Bye for now.